Let's talk about some of the factors that are part of pharmacokinetic factors. Okay, there really is about 5 steps as a drug works its way through your body. And the first is, how do you take the drug in? What is the means of drug administration? Okay, we see down here that there are many ways of taking drug in. We can take it orally, we can put a needle in our arm, take it intravenously, we can inject it right into our peritoneal cavity, we can inject it under the skin like you would when you get a vaccine shot, a flu shot, intramuscular. Some hormone medications are given in the muscle, either in the buttocks or the thigh, or we could inhale the drug. Okay, you can also have patches put on, like the nicotine patch and stuff like that, or some birth control patches. You could have drugs implanted under the skin, like some birth control. So depending on how you take the drug in is going to affect the pharmacokinetic factors. Obviously, intravenous is probably the quickest way of getting a drug into the blood. It's directly injected into the blood. But some of these other factors are a little slower. Oral is probably one of the slower. It takes forever to get through the stomach, depending on if you have a full stomach or not. Inhalation is very quick. This accounts snorting, as in snorting cocaine. So drug administration is a big factor of how effective that drug is, how quickly it can get to the target site, and how much of that active ingredient can get to the target site. The other thing that's involved is the absorption and distribution of the drug. And this is a little bit like we talked about drinking alcohol and having a full stomach. So it depends where the drug is going in and what kind of factors, what kind of tissues are getting in the way or easing the passage of the drug. Number 3 is binding. This is something that is, I bet you probably didn't know much about, but there are proteins and other compounds that are circulating in the blood. And occasionally active ingredients of pharmaceutical agents bind to those proteins. They get locked. This is something called depot binding, D-E-P-O-T, depot binding. And a lot of drugs, we lose the activity because of the way they bind with these proteins that are floating around in the blood. Prozac is a classic example. You take Prozac at SSRI, it gets into the blood, but it binds. It has a good deal of depot protein. That's why you may be interested to know that there's a warning label on Prozac packages says that you shouldn't take certain different sort of nutrients that you take in. And grapefruit juice is one of them. If you take grapefruit juice while you're on an SRI, it affects depot bonding. It loosens up the depot bonding to make more of the drug active at the target sites. This may not be what your doctor wants. More is not always necessarily better. We're trying to figure out just how much will get you the recovery you need, the relief you need, without giving you side effects. So depot binding is a big factor. And it's what's behind a bunch of those bizarre warnings you can see on some drugs. All right, inactivation. Now we go down to inactivation. This is the big one. This is the liver. So everything you take in your body, all the toxins you have taken in your body, anything has to go through the liver to be filtered. And the liver has a host of different enzymes, and they're different with all of us. This is based on your genetics. So some of us have different liver enzymes that are either more effective or less effective at dealing with certain drugs. So this is also something we'll talk about a little later, a little bit, that goes into tolerance and why some people might have higher tolerance for drugs or lower tolerance for drugs. It's because of the enzymes in the liver, how quickly the liver can inactivate those drugs. And finally, excretion. So we have to dump the drugs out to the intestines, the kidneys, the lungs, the sweats. Remember, when you are drinking alcohol, 95% of that alcohol has to go through the liver. 5% comes out through your sweat and your lungs. So when you take a breathalyzer, what the police officers are trying to investigate is how much alcohol is in your lung based on that 5% of alcohol that is being excreted. So if more of it is being excreted faster, that will affect the binding, and that is one of the pharmacokinetic factors.